On May the 15th, the government of Congo declared the country's 17th Ebola outbreak in 50 years, and its epicenter is in the north, in the province of Ituri. As of May the 26th, there are over 1,000 suspected cases and 200 deaths. There are 5 cases in Uganda and 2 known cases in Goma, the largest city in the east where I'm based, but reliable information is really hard to come by. Detection was really slow at the beginning, partly because the tests are not as effective and the symptoms are different from the previous Zaire strain that caused the last outbreak in 2018 to 2020. For this Bundibugyo strain, there's no treatment and there's no cure, and a vaccine is a few months away at best. All this in a region where US aid cuts have decimated health monitoring and where 10 million people live under the M23 rebel authorities. In a standoff between the Congolese government and the M23, Goma and Bukavu airports remain closed, hampering access for medical supplies. There's huge scepticism amongst much of the population as to the existence of Ebola and a real mistrust of the medical centres. Relatives are suspicious of what happens to patients inside the treatment centres, and they oppose the restrictions on traditional burials, and because of this they'll often try and storm the centres to retrieve the patients as well as the bodies of those who've died to give them traditional funeral rites. During the last outbreak there were nearly 500 attacks against health facilities and 25 frontline medical staff were killed. Already the population has set fire to 2 Ebola treatment centres. The Church is on the front line of the Ebola response. We run a huge amount of health centres across the country. We're at the heart of every village and community, and we're one of the few institutions in Congo still trusted to tell the truth. During previous outbreaks, working across denominations, the Church challenged misinformation, replaced messages of fear with messages of hope, and was key in adapting religious practices, particularly burials. But the key is always to mobilise the Church early. As a diocese, we have a lot of experience from the last outbreak. We've already circulated a pastoral letter outlining the symptoms of Ebola and urging best practice with hand washing, touching and with medical referrals. We're also looking to buy temperature guns for all of our schools and our churches. But our main role is at the forefront of awareness raising. Tomorrow we'll hold a meeting for all clergy, evangelists, teachers and staff in Goma. In the future, I'd love to invite all the clergy from across the diocese to come to Goma to strengthen them in their frontline response on the ground. And during the last outbreak, we were successful in bringing senior church leaders and community leaders together, and we worked really closely with journalists on messaging, and this we hope to do again. It's in these areas that we need financial support, and that support will be crucial. And if you'd like to give, please see below. But please also pray. Pray for a quick mobilisation of resources to test and isolate and treat patients, for safety for health workers, for effective awareness raising, that the political tensions would not hamper the response, for the quickest possible development of a treatment and of a vaccine, and that churches would continue to be the voices of hope. Thank you.